Hey, Dr. Thompson. I know that you have a lot of these to listen to, so I will make it really quick, best I can. But this is my summary of chapter 2 so far. So the main things that I feel like, we had talked about is kind of what we talked about in class when it was just, the main focuses of the capstone, like what we can do our projects on, discussing, the difference between a theory, model, frame of reference. And then even in the book, it kind of goes into a little bit more detail about the 5 pillars of a capstone process, and I can't remember what it was called, but basically like how you develop as a capstone student or just somebody in a capstone from a novice, competent, proficient, and expert. But we'll just get started. So main thing I'm going to talk about is the focuses of capstone project. So kind of what we went over in class. One of them is clinical practice skills. This is going to be where you can do a case study on somebody. You can go and actually I guess study like a certain population demographic, like in the clinical setting under an occupational therapist, something similar to that. I think that's something that I might be interested in. Then there's also research. That's going to be not the same as like clinical practice skills, because clinical practice will probably be a little bit more hands-on. But research, it can be like a systematic review. It can be, a higher level, cohort study, case study, all those things. So just something to help push our profession and just the healthcare in general. Administration is going to be you like making a program in a certain way to be administered to a group of people. So like or how do I say this? It's like if you came up with like a financial plan to be able to be used, and now this is like a system that people can use. Like you have now made this administration. Leadership is going to be kind of like basically just like teaching whatever your site or your population how to be like a leader, giving leadership opportunities, showing leadership skills, educating on that, all that great stuff. Program development, that is going to be very much so like whenever you design like something to be implemented for, I know like there's clinical and community program development. So like clinical program development might be, specifically like for a child with sensory like integration issues. Maybe you develop a program specifically for that. But community might be like a more broad term, like if something needs to be done, or like if studies done based on like a certain we'll say a county that is needing adaptive equipment of some type, you can design a program for that. Policy development, that's going to be more so with like legislative, being able to implement new policy, create new policy, change it, all that great stuff. Advocacy, I also could see myself doing this. It's just advocating for different things in our field, for the site, for the populations. I know my brother, he had a spinal cord injury, and so I really, would be interested in advocating for families and even patients in different situations like that. And then education, kind of just basically what it says. Education is you are educating your site, your population on something that like on your project, whatever it might be, to be able to kind of stay and be passed on for years to come. Next was like theory, model, frame of reference. I won't go into too much detail since we already talked about that a lot today. But theory being the overarching, just in general, like what you're seeing, like maybe it is, airs, sensory, like integration, processing, right there. And then your model for that might be the PEO model, where it's person, environment, occupation, all that kind of stuff, and seeing how all these things are working together and what's affecting what. Why would, what could possibly, with like sensory processing, in the environment that you're in, how is that affecting, how you're able to live your life, do your occupations, be a person. And then frame of reference of that would be like sensory integration, being able to implement like different strategies so that you can maybe develop a better environment for your sensory needs. And so just kind of working down from that. And then like I was talking about before, basically the process that anybody will go through a capstone, but especially me as a student. It talks about a novice. Like right now I would be a novice, just a beginner, kind of learning the steps of everything, and listening to the people above me to try and guide me. Competence is going to be, I'm a little bit more familiar. I probably could do a couple things on my own, but I'm still needing guidance. Proficiency is, I probably could do a lot of it on my own. And I've learned a lot kind of through experience and seeing it. And then an expert is, I'm an expert on my topic, my project. Me and my site mentor are able to really collaborate on different stuff. I mean, we'll be collaborating through the entire thing, but that's kind of the end all. So hopefully we'll be getting there with due time. And then last thing I'll talk about is the 5 pillars of the capstone process. And so the 5 pillars is effective, leaders, collaborative, accessible, and then equity, inclusion, diversity. So within those things, effective is going to be, is this client-centered? Is this evidence-based? Some projects that, or focuses that would go under that would be clinical practice and administration. Next one, leaders is this influencing change? Is this a catalyst for something new, something better? And so some projects for the capstone focuses that could go under that are leadership and advocacy. And then you have collaborative. So this is going to be very teamwork centered. Projects for that are going to be like administration, program development, just because you are going to need everybody to be able to work as a team and be on the same page to be able to create a new system or a program, implement a new program. Then you have accessible. So you want to be responsive. You want to be accessible. Some focuses that will go down for that would be program development, advocacy, and policy. Especially for advocacy, you want to be accessible to your population, to your site mentor, for whatever you're trying to advocate for, being able to be there, to be a listening ear, and be very hands-on. And last one would be equity, inclusion, and diversity. And so what this is just being very inclusive and equitable. Some projects that are going to go under that are advocacy, policy, education, just all these things that it is really important to make sure that there's justice and that everything's at a level playing field, especially for those that are not able to, people that we are advocating for or educating, allowing them to be able to experience things with good quality of life and at the same level. So those are the main things that I took away. I know there was a lot of stuff from chapter 2, but even a lot of things that we talked about in class were really helpful, and kind of honestly made it easier to read because we had already talked about it in class. So I understood a little bit better. But yeah, that is all. Thank you.